Border disease. It's a fetopathogenic disease in pregnant ewes and it causes lambs to have central nervous system damage and decreased growth. The occurrence is worldwide. In Hungary, about a third or approximately half of the herd are seropositive. It's endemic. For the etiology, Pestivirus ovis or Pestivirus D, also known as border disease virus, is a part of the Pestivirus genus. It has cross reactions with classical swine fever and bovine viral diarrhea. For the epidemiology, it's a Yerixin virus, so the hosts are sheep, cattle, and wild ruminants. These are the reservoirs. Goats are more resistant. It survives in the environment. There is a horizontal infection through the feces and the discharge, and a vertical infection through intrauterine infections. For the pathogenesis, it's very similar to bovine viral diarrhea, as there are non-cytopathic strains. The virus enters the body through oral nasal uptake, and then the primary replication happens in the lymphoid tissue, and then viremia occurs, and then the secondary replication crosses the placenta and goes into the fetus. What happens to the fetus depends on the age and the virulence. Before day 50, we can have embryonic death in the very early stage, or the animal can be aborted in the first half of the pregnancy. Between day 50 and day 70, we can have immunotolerant lambs. And after day 70, so before day 152, we can have fetopathy. This consists of epithelial damage and central nervous system damages. Immunotolerant lambs and fetopathy is in the second half of pregnancy. Before birth, we can have seropositive lambs, so there's immunocompetent lambs. The clinical signs, yos or ewes are subclinical, and in the fetus and the lamb, you can have a hairy shaker. When the lambs don't have wool, they have dog-like hair on the neck and the back, and it's pigmented. They can also get tremors, convulsions, and paralysis and incoordination. And they can have retarded growth and cranial development problems. Diagnosis, we look at the epidemiology, clinical signs, and post-mortem lesions, such as IF, immunohistochemistry. To detect the virus directly, we do real-time PCR of the semen and discharges, and you can also isolate the virus. To detect the virus indirectly, we do cross-reactions. Viral neutralization is best. We can also do ELISA. For prevention, we need to do selection of immunotolerant lambs. There is an inactivated vaccine, or the bovine viral diarrhea vaccine can be also used.